A case for child life programs. The proven impact on patient satisfaction, patient outcome, employee satisfaction, and hospital revenue by Taylor Wayne, Jordan Bondurant, Jenna Matlock, Liliana Martinez, and Khadijah McCall. The goal of this presentation is to help viewers understand that the addition of a child life program in Steward Healthcare's Arizona network would help promote holistic care for patients and families, contribute to employee satisfaction, and benefit the SHC's, or better known as Steward Healthcare's, bottom line. Within the state of Arizona, the Steward Healthcare system has 4 medical facilities. Each one is pictured below. The first one is the Mountain Vista Medical Center in Mesa. The second is St. Luke's Hospital in Tempe. The third is St. Luke's Behavioral Health Center in Phoenix. And the fourth is St. Luke's Medical Center in Phoenix. This includes over 380 beds, 2 emergency departments, 2 maternity wards, 2 intensive care departments, 1 large behavioral health unit, and several surgical units. What exactly is a child life program? A child life program is a department made up of child life specialists whose main target is to use evidence-based therapeutic interventions to best help children as they prepare for medical procedures. In order to qualify as a child life specialist, candidates have to complete a specific course, volunteer hours, practicum, internship, and a child life exam. According to Parvin and Dickinson's 2009 study, they looked at the curriculum that each child life student has to take in order to qualify as a child life specialist in a hospital. After surveying about 35 programs, they found that child life specialists are exposed to classes that focus on childhood death and bereavement, and childhood clinical issues and techniques. The average amount of time that a child life student spends on this course is close to 33 hours. Thus giving them more experience on how to better relate to children facing this tough issue in the hospital setting. The focus of a child life program is to practice family-centered interventions. What this means is that when using interventions, the child life specialist will involve the family in the treatment as much as possible. An example of this would be if a child was getting ready to receive an immunization. The child life specialist might use a form of distraction in order to calm the child. By asking the parent the child's favorite song or book, they are involving the child and the family in the healing and coping process. They might ask the family to sing along or even have the family read the book to the child as they're preparing for the immunization or as they're talking through it. Another example is the use of siblings within the intervention. The child life specialist might ask the sibling to get involved in art therapy. So when the child is working on painting or expressing their feelings through drawings, they might ask the siblings to join in as well so that the child feels less singled out and more comfortable throughout the entire experience. What do child life interventions look like? Within the field of child life, the concept of therapeutic play is often brought up. Therapeutic play is described as an intervention best used within the hospital setting to give children, ranging in all ages, an outlet to express their feelings around medical procedures. It is the current best practice in the field of child life and includes a broad assortment of activities that allow for the child life specialist to work with the child's interest and empower the whole family. Therapeutic play can be used for children experiencing mild to moderate procedures and is often used as a way to prepare children for what they will experience. Each intervention is targeted to the child's age group in order for the child to understand what is happening in a developmentally appropriate way. For example, a child life specialist would prepare a child who is 3 years old for surgery very differently than what they would do for a 15-year-old. For a 3-year-old child, the child life specialist might bring in a book with a lot of pictures to describe the experience or use dramatic play. The child life specialist can demonstrate the surgery on a bear as to better illustrate to the young child what they can expect. However, if the child was working with a 15-year-old, if the child life specialist was working with the 15-year-old, they might incorporate technology or use a form of art therapy due to the older child's ability to understand more complex concepts. In order to prepare the child for the procedure, the child life specialist will first begin by receiving the child's information. They will create a plan of action that involves understanding the child's background and the procedure they will soon undergo. The next step is meeting with the medical professionals involved with the child's procedure. According to ChildLife.org, child life specialists work very closely with families and interdisciplinary healthcare teams, as well as community professionals, in order to meet the emotional, psychosocial, and developmental needs of the child. After meeting with the medical team and preparing interventions, the child life specialist will meet with the child in the child's hospital room or within the child life room, which is typically stocked with items dedicated to therapeutic play, such as materials for art, dramatic play, or even blocks or music or new technology such as iPads or tablets. The child life specialist will cater each intervention to meet the needs of the child and ensure that it is developmentally appropriate for each age group. Education is a crucial aspect of a child life specialist's responsibility, and child life specialists have many different resources and skills that help children both understand and cope with what they are expecting. Why is this so important? You may be asking yourself, why does this even matter? The addition of a child life program to every hospital matters because oftentimes the children and families that are present are often experiencing illness, injury, treatment, and/or death. It is the goal of the child life specialist to help reduce the fear they may be feeling by working on techniques that help families cope with anxiety, pain, and suffering. When a child or family accesses the SHC, or Steward Healthcare System services, they often find themselves in a very traumatic and stressful situation. Most people are not aware of the coping techniques used to get through illness, injury, and treatment. The child life specialists are trained both academically and through experience on how to help people work through these experiences. According to American Academy of Pediatrics study, they report that child life specialists are flexible assets for any healthcare system. Child life specialists are utilized in pediatric healthcare as well as ambulatory and the emergency department. The SHC, or the Steward Healthcare Services, can utilize child life services in their emergency department and outpatient services in addition to in-house patients to enhance the overall services provided. According to Boll and Blinkman, child life specialists' unique skill set can add flexibility and have a positive effect on quantifiable measures in patient satisfaction, child pain, and child distress. It is within the addition of a child life program to each facility through the Steward Healthcare System that they will see better results in their overall patient satisfaction. Within the images on the slide, one can see that each child life room is set up to attract families and make them feel more comfortable. The use of interactive games and manipulative items help children feel that this is a comfortable environment rather than a scary hospital. Within these rooms, child life specialists work one-on-one within group settings to provide enhanced services to meet the family's needs. By adding a similar program to the SHC, they too may have their patients leaving feeling more confident about the procedures they will soon undergo. Patient outcomes. In order to understand why the addition of a child life program is so important, it is best to understand how the patients feel. When a child or family goes through procedure with a child life specialist, they will often experience a number of responses. The first is a reduction of emotional distress. Pictured above is a child life specialist blowing bubbles with a child. In order to help a child feel less anxious or scared before or during a procedure, the child life specialist may use a form of distraction. Blowing bubbles can help the child take their mind off of what is to come and enjoy a visually and physically stimulating activity. This activity, in addition to others, will give the child a feeling of calmness as they prepare for the procedure. Child life specialists also work to reduce negative physiological responses. Oftentimes, as children prepare for procedures, they may have negative responses. This can be seen in the form of sweating, fainting, or acting out. An example would be if a child was preparing to receive a shot. They might begin sweating due to nervousness. When working with the child life specialist will first explain what they are about to receive and why it is happening. From there, the child life specialist will work with the family to better understand how to distract the child, if needed, during the procedure. Pictured above is a specialist reading a book to the child while they receive a shot. This image is a great example of how the child life specialist incorporated an activity the child enjoys, while including the family in the procedure. The child's mother is also holding him and engaged in the story as a means to better distract the child from the anxiety he may be feeling. The third outcome a patient may feel is leaving with a sense of preparedness for the procedure. Oftentimes, child life specialists spend a great deal of time preparing the child and family for what is to come. Using developmentally appropriate language, the specialist will bring in images, videos, music, or stories to help the child understand what is going on. Before the child ever enters the procedure, they should have a general idea of what will happen to them. The child life specialist also works with the families to answer any questions or concerns they may be feeling, in the hopes that they too will not feel anxious about what is happening. The fourth outcome is a sense of increased cooperation. The ultimate goal of the child life specialist is to work with both the child and the family, as well as the medical professionals, in order to develop the best response to procedures. It is through clear communication that the child life specialist can work on the cooperation of all participating parties. It is very important that each member in this experience is on the same page in regard to the child's medical needs and plan. Once everyone is on the same page, the procedure will continue. It is also important to note that oftentimes emergencies happen and plans will have to change to fit the needs of the child's overall health. The child life specialist will work with the families and the child to ensure that they feel that they are too in the loop with the overall care of their family member. The last outcome is the feeling that families have additional support through the entire process. From the moment the families check into the hospital, the child life specialist should and will be working with them to ensure that their child leaves feeling aware of what is going to happen. The child life specialist can work with the families to provide resources for taking home coping skills that the family can practice when the specialist is not there. Overall, the goal of the specialist is to be an advocate for the child and the family as they navigate through the hospital setting. Steward Healthcare System would benefit by providing better services toward pediatric patients. According to the Child Life Council, child life specialists are essential support to children through their hospital stay. Research shows that preparing children for the medical procedure will likely reduce anxiety, fear, and children will be able to adjust better to medical challenges. Children that are exposed to trained therapeutic play increased children coping skills and help children process their negative thoughts and concerns. Child life interventions can increase cooperation and help to ensure procedural and post-procedural responses. Providing family support will allow family members to remain calm and transfer their emotions to the patient. This has a direct impact on the environment of the hospital and helps ensure a calm environment for all. Cost effectiveness. When discussing the importance of adding a child life program to each facility under the Steward Healthcare System's domain, it is imperative that the concept of budget is discussed. According to the American Academy of Pediatrics, they mention that despite the fiscal toll that a child life program would add, it would still remain an important part of the overall health of children. By creating a humane and natural form of providing care to children and families, hospitals that have a program similar to this are seeing an overall better success rate. The importance of the program remains despite the fiscal responsibility. By adding a child life program to the Steward Healthcare System, it would be placing a value on the family dynamic and the importance of children's overall health. There was a clinical investigation conducted in the state of Florida at the University of Miami Sylvester Comprehensive Cancer Center and Jackson Memorial Hospital, where children treated with radiation therapy were surveyed. The study primarily focused on the need of anesthesia of children being treated with radiation therapy. The purpose of the study was to see if the need of anesthesia would decrease by employing child life specialists, which would ultimately lead to lower healthcare costs. Child life specialists provide play, education, and therapeutic intervention to these children, which can reduce the need of anesthesia for those receiving radiation therapy. The results of the study showed that after employing child life specialists, there was a 16% reduction in the need for anesthesia. On average, a child life specialist can make anywhere from $30,000 to $40,000 yearly. Depending on the size of the hospitals and the need, Steward Healthcare Systems would need to employ at least 3 to 5 specialists per hospital setting, totaling about $200,000. This does not include materials needed for therapeutic play. Despite the additional expenses this may cost the hospital, it does come with benefits for both the patients as well as the hospitals themselves. The first benefit is that it prevents the need for expensive healthcare techniques. Similar to the study mentioned earlier, child life specialists often use a holistic and natural approach to working with children. They use concepts of distraction and play as a means to help children understand and cope with the procedures they are facing. By using this technique, hospitals will not have to pay as many staff members to restrain a child when they are physically afraid and can potentially use less medication, such as anesthesia, to help children get through the procedure. The second benefit is that the use of child life specialists can replace the need for other therapeutic strategies. The goal of the specialist is to meet the family where they are at during their stay in the hospital. Typically, children and families have little to no understanding of what is to come. However, the specialist can provide information and coping strategies the family can take with them in the future, thus reducing the need for additional therapists post-procedure. The third benefit of adding a child life program would be the lower healthcare costs for facilities. By incorporating a program of this kind to each hospital, the facilities will be able to cut back on additional expenses dedicated to helping a child cope. The child life specialist will work with the families to understand procedures and use therapeutic play to calm the child pre- and post-surgery. Lastly, the Child Life Program addition to Steward Healthcare Systems can benefit costs for families. Typically, when a family visits a hospital, they are often given a bill with numerous expenses for their stay, food, services provided, and medication. If a child life specialist was to work with the child from the beginning, the bill would often reflect less medication, such as anesthesia, and ideally less healing time in the hospital. It is through the use of their therapeutic play that the child will understand how to self-cope and require less time than they will need to be admitted into the hospital. Overall, the benefit of adding a child life program into a hospital can ideally outweigh the cons. With the use of age-appropriate therapeutic interventions, children and families will leave the hospital feeling more satisfied with their care and hopefully more confident with the treatment the medical professionals provide. And so, I leave you with 2 questions. The first question is, do you feel that the addition of a child life program to each of the hospitals under Steward Healthcare Systems is a feasible goal? Is this something that they can potentially do within the next 5 years? And lastly, do you feel that the addition of a child life program is worth a financial toll it might take on the hospital? Thank you for listening.